You're watching In Your Interest, and the big question we're asking on this edition of In Your Interest is, are hospitals scamming you? Have you checked your hospital bills to understand what are the things that you're being charged for? Let's find out. The healthcare sector in India has been hit by what is being called as peak charges or surge pricing. This time around, it's not the cab that you booked where you paid surge prices or the delivery that you booked. It's for your hospital bills. From disinfection fees to peak charges for operation theatre time. These additional fees are making healthcare increasingly expensive. Insurance executives have sounded off the alarm bells, noting that insurers who once provided comprehensive packages with predictable costs are now grappling with an unbundling of services, which basically means if you book a hospital room, you will be charged for the room separately, the nursing separately, to your treatment separately, unbundling of services, taking out everything and charging them individually in your bills. This shift has come at a time when medical inflation has already soared to around 14%. That's right, 14% of medical inflation. And that is closely mirroring the rise in retail inflation as well. Now, despite the expansion of healthcare services, affordability remains a pressing issue for many Indian citizens. Medical procedures, surgeries, and even essential medicines now come with price tags in lakhs of rupees. For those without health insurance, the financial burden of medical bills can be devastating, to say the least. That's further complicating an already challenging healthcare sector in India. Costs are continuing to rise by the day. But the question remains, how will this trend impact access to essential healthcare services for the average Indian? Let's find out. We have a couple of very special guests joining us on the broadcast. We have Mr. Lokesh Dhamania, Chief Financial Officer of Clear Medi Healthcare. Thank you so much for being with us. And also, we have Dr. Ishwar Gilada with us on the broadcast. Thank you, Dr. Gilada, for taking time to be with us. Let me begin by asking Lokesh, talk to us. What is this unbundling of services, and aren't the charges and the costs already high?
Yeah, hi. Thank you, News9, for giving me this opportunity to share my views. So in this, I must say we have to see three aspects to it. When we are saying it is increasing day by day, as you mentioned, also 14% surge in medical charges and healthcare services. So there are other costs also in the same field. If you see, one is if you see per capita income has also increased as compared to 4 years ago, and now it is 20%, which is currently. Another is medical technology. You know, the major chunk goes into the medical technology to take into the hospitals, which is too high and which is mostly imported kind of machineries we are buying in the hospitals. So this is one part. So if we will see something which will be in India, if we will be able to manufacture that kind of radiology services, radiotherapy services, and these kind of high cost medical technology, if we can introduce in India, I can see that will be, we can say that affordability will be there. Because as far as currently you can see, before that you have mentioned that we are at highest price of our dollar. Now everything hits to the medical technology directly, because every time whenever big hospitals are taking new machinery and everything, it comes with a cost, which is depending on dollar, definitely. As secondly, the import duty and the cost which spent on importing these kind of assets. And third major aspect is the technology. So when we are talking about AI technologies into the medical field, that is also play a very vital role these days to maintain the accuracy and the assignment things which can be minimized from the risk. So these are the three factors which is day by day growing, by which the overall cost for the treatment is increasing day by day. The remedy, what I feel, one is we have to set up good companies in India who can generate revenue through their internal patients, and the medical technology should be there in India, like manufacturing units we are having for like automobiles or other sectors.
Okay.
But we don't have that kind of facility in India for medical
Mr.
technology.
Lokesh Damani, you're essentially saying the costs of providing treatment have gone up because the equipment is expensive. Most of the equipment has been imported. Dr. Ishwar Gilada, has something changed drastically in the recent past? Because suddenly hospital bills seem to have shot up much faster than the price that the rate at which prices of vegetables are shooting up.
See, basically, if you look at hospitals or nursing homes, they are not run by doctors, they are run by business people. And for business people, whether business is A, B, or C, it is a business. Number two, if we are now worried about surge in prices, we should have been worried about 30 years before when the commercialization in medical education started. And we vehemently oppose that in medical profession there should not be commercialization. Everybody should be admitted with merit only. But when the commercialization started, for example, currently the medical seats are sold at the cost of 1 lakh, 1 crore to 2 crore, and postgraduate seats are sold for 2 to 3 crore. So you can imagine if a postgraduate doctor is there who has spent 5 crore on education, that person will minimum recover 5 lakh per month, which is a 1% interest rate per month. Now, if 5 lakh is recovered, it is only bare minimum cost he is recovering on his investment. And that person has to earn at least 10 lakh to see that 5 lakh is paid back for the investment. So that is a simple economics. Now, if that 10 lakh has to be per month has to be recovered by just a fresher doctor who is a postgraduate qualified doctor in practice, how do that person earn? So they will have to do some kind of uh, commercialization in their private practice, and that by that way that person is going to recover. So number one, we should stop total commercialization in medical education if we want to have a good result in equitable practice in private practice. Number two, the hospitals which are run by business people. Everywhere there are charges like surcharges or those charges they try to recover. In some places there are something like ventilator on standby. So suppose you are admitted in a hospital, you are critical. They'll say, sir, tomorrow if you need ventilator, we don't have. If you want to reserve the ventilator, there will be ventilator on standby, and you need to pay standby charges. Number three, there are charges like registration charges. If a patient is admitted in a hospital, what is the registration charge? There will be registration charge. There will be all disposable thing will be charged like gloves, masks, syringes, needles. They're all when they're charged on per piece basis. Whereas the hospital is buying at almost 70-80% lower cost than that. So cost will be inflated. Secondly, the story is related to insurance companies. Insurance companies are also their motto is not to settle insurance. Their motto is how to deny insurance. So they will always try to see existing disease. For
Okay.
example, I'm a HIV and infection disease specialist. A patient is admitted for knee replacement. They will say, no, you cannot be given insurance because you are HIV positive. Now
Right.
you tell
But Dr.
me
Gilada,
how HIV positive is related to knee replacement. Knee
Dr. Gilada,
replacement is for growth.
and in fact, in this particular instance, it is the insurers who have raised the alarm bells. Lokesh Damania, it is the insurance industry and the insurers who have raised alarm bells about rising costs that they are not able to, foot, because at the end of the day, if you have medical insurance, they have to foot the bill. Despite all the categories in which they can deny the claim, there are some categories in which they have no other choice, and those bills have gone up so much.
Yeah, actually, if you see insurance companies also, they also done the capping on the basis of their sum insured. Okay, so if you buy a insurance of rupees 5 lakh rupees, you will get a different kind of services. And if you buy a insurance of 10 lakh rupees and more, so they will not deny. As you said, they cannot deny on those patients where they are generating money more, but where they have a limited kind of value of based sum insured, so they are putting most of the thing into non-medical kind of expenses. So now the insurance company and the patient. So what insurance companies are doing, they are negotiating with the patients, and many times we have seen patient has to pay a minimum amount of, if you consider 1 lakh rupees of bill, so approximately 10 thousand rupees is the value which patient has to pay. Means approximately 10% is the value which they deny to the hospitals, stating that these are the expenses which is not covered into the policy. It is like that. So anyway, if I am buying insurance, after that, even I have to pay many things because hospital is charging differently. And one more thing, every patient has the right to review their bills and ask for each and every services from the hospital. As doctor has said, that is currently absolutely right, that many charges, which is not at all should be there in the bill, which is not directly linked with the patient, but still they are charging. That they have 100%, they have to raise their concerns. If people will not raise their concerns, definitely hospital will charge many things in a different way. I agree with doctor's point also that number of seats is purely a commercialized these days. So everybody is like when they were enter into the industry, they start from day one that how they want to charge into the patients and what kind of services they want to give to the patients. So these
Right.
are the really kind of points which we as a patient we have to
Right.
see and we have to talk about on this.
We have to talk about it, and we have begun that conversation here, but I'm afraid we've completely run out of time with that. I'm going to thank Mr. Lokesh Damania, Chief Financial Officer, Clay Medi Healthcare, and Dr. Ishwar Gilad, our Senior Medical Practitioner, for taking time out to be with us here on this edition of In Your Interest.